So as I said, the first presentation is by Dr. Lindsey DeVries and Dr. Caitlin Middleton. The topic is, as we said, navigating healthy relationships in adolescence. It's really fun to introduce both of them because you may or may not know that they both were postdocs with JFK. And so I have personal knowledge of their great strengths as clinicians, speakers, clinical researchers, and we're just excited as we can be to have them here to present their knowledge, and especially on this topic. So let me do some really quick individual introductions, and then I'll hand it over to the two of them. So Dr. DeVries is an instructor in the Department of Peds here at the University of Colorado, and the psychologist at Developmental Pediatrics at Children's. She received her BS in psychology at the University of Wyoming and her MS at Eastern Kentucky University, where she completed an interdisciplinary certificate specializing in autism spectrum disorder. She completed her PhD in counseling psych at the University of North Dakota and a 2-year postdoc, as I said, at JFK. Research and clinical interests include the assessment of autism, co-occurring mental health conditions, sexual and reproductive health in individuals with ASD, and the influences of having a child with an ASD on family well-being and functioning. Dr. Caitlin Middleton is a licensed psychologist, assistant professor in the Department of Pediatrics and Psychiatry, also in developmental peds here at the university. She received her BA from the University of Miami and a PhD from Stony Brook University, and did her postdoctoral work with us at JFK. Her primary area of clinical and research specialization includes assessment and treatment of autism and evidence-based mental health treatment for ASD. She's also certified in parent-child interaction therapy, has various peer-reviewed publications, book chapters, and many different presentations. So I'm going to stop there and turn it over to them, and then I'll come back on in about 45 minutes or so to try to moderate some Q&A. So take it away, Lindsey and Caitlin.
Thank you, Judy. Right. All right, hopefully everyone has their videos off. Hopefully you can see our screen with the full PowerPoint and not our notes.
You can see the notes, Caitlin.
You can see the notes.
It's in presenter mode. I can't see the full screen.
How about now?
Perfect.
Okay.
Okay, so thank you, Judy, for that warm welcome, and Sandy and everybody who's taking time out of their Friday this morning to attend this webinar. Caitlin and I are really thrilled to be here today to discuss a number of important topics surrounding adolescence for individuals on the autism spectrum. So first, we want to talk a little bit about our learning objectives. We want to make sure that when you walk away from our presentation today, you have some knowledge about the different core components of relationship building for adolescents with ASD, including gender identity, dating, and social safety, and thinking about how these unique challenges for adolescents with ASD can impact healthy relationships, and in particular right now during the global pandemic. And then lastly, we're going to cover some strategies for skill building and establishing safe and appropriate relationships with others. Now, before we get into it too much, we want to be able to think a little bit about what could be some of the challenges for adolescents with ASD navigating relationships. So if you all would type in the chat some of the things that you think of when people ask about challenges that might come up during this period of time for individuals on the spectrum, that would be great.
Online dating, misunderstanding social cues, communication, boundaries, social cues, isolation, feeling isolated, trusting others too much. These are really good. Not able to do small talk, changes in routine, harder to use or to read nonverbals over Zoom, parents being overprotective, changes due to COVID, gender identity not being taken seriously, issues of consent. Wow, you all are raising a lot of the things we're going to be going into. Difficulty with keeping and making friends, sensory issues, the changes from elementary to middle school, friend changes. These are great.
Yeah, absolutely. I think you guys are touching on a lot of the things that we're going to be talking about today, which is really exciting. On the same hand, we want to talk about a lot of the strengths that people with ASD bring to relationships too. And so while we'll be talking and focusing on a lot of the challenges, we also want to hear from you. What are some of the strengths that you guys think are unique for teens and adolescents and individuals with autism in particular in forming and maintaining relationships?
Empathy, honesty, attention to environment, deep connections, lots of honesty, a unique perspective in the world, kindness, artistic talent, being candid, being authentic, trust, communication. These are fantastic. Creativity, a lot of good strengths, wanting to be a good friend, loyalty, yeah, absolutely. Intelligence, perseverance, absolutely. Creative thinking and unique processing. So many strengths.
Yeah, and I think that you guys are capitalizing on a lot of the pieces that we want to focus on too, because like I said before, we want to make sure that we're highlighting these strengths and thinking about how to play on those strengths and maximize them to support individuals in some of the areas that may be more challenging.
And thinking about the attention that individuals on the spectrum have gotten more so in the media, where these shows are showing a lot of the strengths of individuals. Some of these are fictional characters like Big Bang Theory, The Good Doctor, Atypical, but some of these are reality shows. Love on the Spectrum came out this summer. There was an individual on the spectrum who was on America's Next Top Model a few years ago. And these shows do show strengths as well as challenges, but it's way more complex than that. And so one of the things that we have learned is that kids going through transition years, teens and adolescents into young adulthood, often need more support during those times, when in fact they often receive less support. And we're going to talk about some of the challenges that get in the way where we want to give more support, and then we're going to get into some strategies around how to support. All right, so first let's talk about ASD in adolescence.
And I think it's important when we start this conversation to really think about what is typical and what do we might expect in adolescence. And, you know, one of the things that we expect to happen is that peer groups become more meaningful for individuals when they enter adolescence. And you start to see that peers start to become a source of education, not only regarding, you know, trends and what's popular, but also gender identity, sexuality, relationships, friendships, and development. You also see that there's this push and pull towards independence where your peer groups are mattering more and your family is taking less of a role in that place for teenagers. And you start to see that this looks differently for individuals on the spectrum, but for all teenagers, we would expect that you would have some push towards this independence when we're thinking about daily living skills, choices over music, how they dress, relationships with others, and how they want to spend their time. And then lastly, gender and sexuality exploration is normal and typical in adolescence as well. And we'll start to talk more about how that might look for individuals on the spectrum. Before we start to talk too much about this piece, we want to review just a little bit about what autism spectrum disorder is. We know that many people in the audience have knowledge about autism spectrum disorder, but we want to quickly provide a brief overview of some terminology and challenges that are characteristic of autism spectrum disorder for individuals in the audience that may not know this information. And so when we think about autism spectrum disorders, clinicians and researchers often think about two different areas: social communication and restrictive interests and repetitive behaviors as core deficits, or what we would think of as unique challenges that go along with autism spectrum disorders. And it's important to mention this because these differences and challenges can look very different in adolescence and adulthood than maybe for young children on the spectrum. And so we'll be often referencing these areas in our presentation to describe these unique challenges that people on the spectrum may experience that can be different than neurotypical peers. So when we think about barriers, there are a number that come to mind when we think about adolescence and navigating that road. And for many people, adolescence is a very tumultuous journey, and there are a lot of changes that are taking place. But for people with autism, one of the things that can be uniquely challenging is the increase in social demands. And so when we think about adolescence and friendships, we think about how nuanced and sophisticated they become when we compare them to maybe early elementary school or middle school, and how the rules to the game begin to change. And that can be really challenging for folks on the spectrum or that are autistic. We also see that we have those increased expectations for independence. And this can be challenging if maybe the skills that an individual has for carrying out daily living activities or being able to do the things that they really want to do don't necessarily match up with the same desire that they have. And so they may need more support from other people in order to be as independent as they may want to be. We also see that there's an increased risk for mental health, and we'll be talking about this a little bit more, but we know that in adolescence, we see an uptick in things like anxiety and depression, and people with autism may be more prone and predisposed to developing mental health conditions. And so we want to think about how to support mental health, especially when we think about adolescence. And then lastly, when we think about those core deficits. And so we're going to now talk more about the core deficits and thinking about social communication skills and abilities, as well as unique ways of processing sensory information and restrictive and repetitive behaviors. When we think about social communication challenges and that aspect of autism spectrum disorder, there are several different areas that can pose a unique challenge. First, there may be barriers to forming relationships with peers. Sometimes this can be due to a lack of skills and not knowing how to make friends because those social rules become more nuanced. And it might be even more difficult to know how to navigate the rules of how to meet friends, how to deepen friendships, and how to maintain friendships once you have them. For some teens, they may have more limited opportunities to form relationships because maybe they have a small social circle to begin with in the first place. Or maybe they don't have interest in forming relationships with other people, or they are really struggling to form those initial connections. This can also be applied to areas of intimacy. It can be extremely challenging to know where to start a romantic interest, maybe how to pace those relationships, and how to read social cues regarding the context of the situation and when a friendship may be moving to a romantic interest. And while most teens struggle to navigate relationships in some regard, we want to think about how to add proactive strategies to prevent tricky situations like cyberbullying, sexting, or inappropriate relationships that may pop up for teens on the autism spectrum.
The other area that we think about for kids on the spectrum is sensory differences. And kids who are really young have different sensory challenges or needs than teens and adolescents. the sensory experiences in adolescence can be really intense and overwhelming. There's new sensory sensations, gotta learn how to put on that deodorant, gotta learn how to wear a bra, have to learn all the steps to menstrual cycle. Those kinds of things can really be sensory overwhelming when you're first learning how to do them. It can also cause a lot of embarrassment and discomfort or pain, going through and learning how to take care of your body in these new ways. And it's also a time when teens want more independence from their parents. When they're younger, their parents can help them take a bath and get into pajamas and brush your teeth and help with all of those routines. But in adolescence, it becomes less appropriate for parents to help with those routines. And so that can cause friction when kids need more support, especially in the learning stages of these routines, and yet they want more independence. The other sensory piece is that teens like to do new activities that might be sensory overwhelming to kids on the spectrum. Teens like to go to malls that might be crowded. They might like to go to loud restaurants. They might like to go to concerts. And so those activities and situations can be hard for kids on the spectrum if they don't want to do that because of sensory overload. And so that can create more isolation or less opportunity to connect with peers around those interests. The other piece, and we're really talking about that second bucket, the restricted interest, repetitive behavior piece of the core challenges that come along with having ASD, is rigid thinking. And this is going to tie through with other things that we talk about, but rigid thinking can impact a lot in adolescence. Gender roles, thinking about gender roles in a really black or white thinking style. So I am a boy. There's a thought bubble on this slide and it says, I am a boy, therefore I must like girls. But that may not be true for all boys. And so having the flexibility to see gender roles in a more nuanced way, and teens are exploring their gender and their sexuality, which we're going to talk about a little bit later. So black and white thinking can really pigeonhole you into an either or type of style, and that can cause problems. The other thing is expectations in adolescence. I mean, what adolescent doesn't want to turn 16 and just leave the house and be able to drive and have a boyfriend or a girlfriend or just do whatever they want? And unfortunately, as we all have had to learn, that is not what is realistic. Expectations or realistic expectations need to be set. And kids who are rigid thinkers might think, hey, I'm automatically 16 this year, I can drive, without thinking about the steps that you might need, the prerequisites that you might need to be able to drive. When I work with kids or teens on the spectrum, this is something that we work on a lot, is managing expectations, thinking about more realistic expectations, and working to be more flexible in that thinking pattern. So the example here, I'm in high school, so I must have a boyfriend or a girlfriend because that's what's expected in high school. And again, thinking about what are the prerequisites to get to that point. The other two pieces here are understanding consent, which a lot of you wrote in the chat when we were talking about challenges that come along with having ASD. Consent is a really nuanced thing. You have to think about, when do you give consent? How often do you give consent? Who gives consent? How long does that consent process last until you have to give consent again? And so these nuances are hard for rigid thinkers to be able to understand all of the pieces. And that can really increase vulnerability for teens on the spectrum and putting them, like Lindsey said, in tricky situations where it's hard to understand those nuances. And then the other piece is interests. Kids on the spectrum can have intense interests or strong interests in things. And these interests may be similar to their peers' interests, but they may not be. Sometimes they're different interests in that they're just generally different, but other times they're interests that may be younger kinds of interests. So kids that are, just about to go into ninth grade and they really like Roblox, or they like Five Nights at Freddy's, all of these video games that are super popular right now, but that might be more what kids in middle school are liking. And so that creates challenges with being able to connect with other kids who like the same things that they like. And then the other thing that we've seen is that kids on the spectrum might get stuck on their own interests and are unwilling to try any other interests, which can pose a different problem. I've totally heard kids say, well, he plays D&D and I play Magic and we just can't be friends because we like different things. And so that unwillingness, that rigidity, kind of going back to that rigidity there, of being able to think outside the box, to be able to be okay with, yeah, friends can have different interests and that can be okay. And this can limit some of some of their social opportunities or social experiences. And then finally, we have to talk about mental health. It's been mentioned a few times already, but kids with autism have vulnerabilities that really put them at greater risk for developing mental health conditions. These vulnerabilities can be things like communication challenges, emotional understanding, perspective taking, rigid thinking. It can be negative social experiences that put them at greater risk for developing mental health conditions like anxiety or depression. And then there's this loneliness piece that tends to crop up in adolescence. And this is a common experience for all adolescents. And there's also egocentrism that comes along with being an adolescent, the feeling that I'm the only one going through this experience. No one else can understand my point of view or where I'm coming from. But the added layer here is that kids on the spectrum have a harder time thinking about what other people think about or taking the perspective of other people, and may get bogged down in that kind of isolation feeling. I'm the only one that feels lonely. And so that can intensify the loneliness in adolescence. And then finally, there's that rigidity again. For kids that are really rigid, it does get in the way and increases the challenges around mental health, especially with thought patterns and thinking, anxious thoughts or unrealistic thoughts that they tend to get stuck on.
And then there's COVID. And we know right now that this is really a mixed bag for a lot of the people that Caitlin and I directly work with that have autism. Some of the families that we talk to have kids that are really thriving right now because the social aspect of school and some of those challenges that they were navigating every day has been more limited. And so they have been doing really well and their mental health is looking really great. However, at the same time, there's more limited opportunities to practice those social skills in real time with peers. And so lots of families have concerns about how do we support these social connections and help my child in this area that is historically really hard for them when there are all of these barriers in place. And this can be especially challenging when everybody is doing so much online, and maybe online is not a great option for all people. Some individuals have a lot of sensory differences, and spending a lot of time online can be really challenging or not a good fit. And likewise, spending a lot of time outside and in social situations wearing a mask or being socially distant is really difficult too. And so we see that everyone is racking their brain to think about how to support kids during this time. So we'll start to give a few thoughts about ways that maybe we can tailor some of this teaching in thinking about COVID. But we want to also highlight that there isn't a right answer. And this is really complex and can apply and look different ways for different people. So next we want to transition to considering some strategies that can be helpful in one of these large areas of challenge, like building relationships, and especially during the pandemic. So one of the things that can be really helpful is to think about what teenagers know and what their understanding of relationships is, and where those gaps in their relationships and understanding might be. And it's really useful to think about different areas of strength and how we can play on those when we're thinking about these areas and what to teach. So some areas that can be helpful to consider is how are people in relationships, and what does my teen know about that? How are relationships different between parents and children, or between spouses or coworkers or friends? And what is it that people do in various relationships? What is okay and maybe not permissible depending on your relationship and how close you might be? And then also thinking about how relationships change. And I think this is really important in adolescence, because we start to see this morphing of friend groups and social circles. And sometimes when we're thinking about people that might be more rigid in their thinking, it's really challenging if these friendships start to change as they get older. Whereas maybe this person was your best friend in kindergarten, but maybe no longer you guys aren't that close any longer. And it can be difficult to think about explaining how to pace relationships or help a relationship if they're interested in maintaining it. And then also thinking about intimacy and what it means to be intimate. Intimacy doesn't necessarily need to be sex. And thinking about how close you are to an individual and what intimacy looks like can be an important conversation to have with an individual as well. And then lastly, I always like to highlight thinking about slang. And this kind of goes back to the importance of thinking about peer groups and bridging the gap in potential misses in reading social situations or understanding. One way that you can help support these conversations is using some visuals. And this is a nice visual from the Vanderbilt Healthy Bodies Toolkit. And what you see here is what's called a circle of relationships. So there's an inner circle, which features the individual. And then you see that the circle starts to expand out wider and wider to illustrate the closeness of relationships. So you and your romantic partner are kind of in the center, and then it expands to family, friends, coworkers, acquaintances, and strangers. And this can be a nice way to illustrate how maybe to move within those relationships. So if your child is interested in maybe dating somebody and they're a friend or acquaintance, well, where are they in my circle now? And how do I close the gap so that they're closer to me in my circle? And you can start to think about topics that are appropriate to talk about within different levels of that circle, or behaviors, or some of those other things that we just discussed. So one way to think about supporting relationship building in times of COVID is, once again, kind of thinking about utilizing strengths and how to build upon that gap or those missed opportunities because of the limitations that are put on all of us right now. So there are a lot of opportunities online that are a great fit for a number of people on the spectrum. So things like D&D groups online, or Netflix party watching app and being able to watch movies with individuals. Online trivia that might line up with special interests like Harry Potter or things like that can be a really nice opportunity to make connections. Or there might be opportunities outside or socially distanced that feel like a great fit for you and your family. But it's also important to think about how are current relationships being maintained, relationships that maybe your child had prior to the pandemic beginning. Are there areas where maybe parents need to, or providers need to be providing support to make sure that teens are texting or checking in on friendships or finding ways to keep those connections close? And then also thinking about really what fits for your family. And this kind of goes back to what I said before about how there could be unique challenges or things that can vary from family to family that really might impact what opportunities you guys feel comfortable with in setting up to support these relationships. Another common concern, particularly with online relationships, is social safety. And so we're going to talk about a few strategies to help think about social safety as well. One foundational skill that I'm a big fan of is thinking about public versus private. And so when we think about public versus private in its simplest terms, public would be an area or a space where anyone can access it, anyone can go. Whereas private is something where maybe it's just for you. So this can be applied to a large number of areas, which I really like. So this could be applied to body parts, what's okay to show and what is not, conversations, where daily living or hygiene tasks take place, touching or social behaviors, or if we really want to get nuanced, thinking about conversations or information that's shared. So one simple way to do this might be a sorting task for some learners. So one of the things that is pictured on the screen is a public versus a private sorting task. And then there are two cards with different behaviors. One is dancing and one is passing gas. And so you can use visuals like that and do a sorting task to help establish where maybe a person's knowledge base is. But you can also make this more sophisticated and use that circle that we pictured earlier and have conversational topics or information that's shared. And thinking about this in terms of the internet can be really tricky too. Is a private message on a social media app really private? Or is Snapchat really private? And thinking about some of those things that might be more nuanced and really relevant for teenagers can be especially useful. And of course, many of you have touched on consent, and we agree. Consent is a huge issue and something that we really want to think about from a safety perspective in helping adolescents, whether or not they have autism, understand. And it's important to recognize that although consent is often portrayed as specific to sexual relationships, this really applies to a number of important areas, especially around things like hygiene tasks or just wanted or unwanted touch. And these conversations can really start early and involve behaviors such as whether or not hugs are wanted or whether or not they're appropriate based on the context. This can obviously be tricky because of all the reasons that Caitlin shared. There's a lot of unspoken rules and things that can be hard in thinking about getting consent and understanding consent. So if a person verbally says yes, but their body language is maybe saying a different message, how do you navigate that situation? It can also be important to think about legally who can and cannot consent. So if we think about maybe a 16 or 15-year-old who has a strong interest in World War II memorabilia and makes a really great connection online with somebody that's much older, is that a relationship where they can legally consent to? And thinking about that from a safety perspective, even though they may have common interests or things that they really feel a strong connection with this individual. And part of why consent can often be confusing is that consent isn't stagnant. And I think one of the challenges is oftentimes when people think about consent, they only think about the aspect of giving consent and teaching somebody to say yes, rather than also thinking about how to accept no and increasing flexible thinking, which can be really helpful when we're thinking about how to support folks on the spectrum or people that might just be more rigid in their thinking.
All right, so now we are going to talk more about dating, which does relate to consent in a lot of ways. But some of the things that you want to think about, first and foremost, is the teen ready? And how would you know when they are ready? Dating is something that is a natural and normal part of becoming a teenager. The curiosity about how to flirt, how to ask someone out, how to say no if somebody asks you out, or how to accept no if somebody tells you no and you've asked them out. And so thinking about all of these kind of normal processes that adolescents are going through, we need to know if the teen is ready to in fact start dating. And one of the ways to know this is individual interest. If a teen is expressing curiosity or asking questions about it or Googling things or going on social media to, find out answers to things, then that's a really good time to bring up and have these conversations. But we also have to put them in the context of family and culture and family values and cultural norms for the family. And so I know in my family, I was not allowed to date until a certain age, and that was the rule. And so sometimes, again, with rigid thinking or with just expectations that I'm going to be a teenager and get to date is not always the case. There's more nuance and gray area there that has to be worked on in collaboration with a family. And then another really important piece here is that adolescents are going to fumble through a lot of these things. Dating is hard, flirting is hard, learning how to have a crush and be rejected is hard, but it's something that everyone goes through. And everyone makes social missteps, meaning minor things that happen that might be embarrassing. You might not want them to happen again. But those things are okay, and that's going to happen, and they're teachable moments. It's the serious errors that are more concerning a lot of times. And I think about a serious error as persistent, inappropriate behavior around dating or relationships, not taking no for an answer. Those kinds of things are that's where we want to focus our attention in what to teach and how to teach kids on the spectrum as they're getting into this dating process. But so we'll talk about what to teach, and there are whole manuals about dating and creating relationships, and we obviously can't cover all of that today, but we can go over some of the main points or some tidbits to think about as you're thinking about what to teach. But first, it's really important to take an inventory of the skills that kids have, because they're going to come to the table with strengths and skills that they already have that we can then use to build upon. And then thinking about what still needs to be taught. And I referenced this before when I was talking about rigid thinking, that kids expect certain things to happen when they're a teenager, but that there are these prerequisites that you have to learn before you can do those things. And often when I'm working with kids, I talk about responsibility. Dating is a huge responsibility. Driving a car, it's a huge responsibility. And what are the things that go along with having that responsibility? Yeah, it's an awesome responsibility that we totally want you to have, but we also want you to be able to remember where your keys are and be able to remember your wallet and make sure you have enough money when you go out with your friends, and be able to do all of the hygiene and daily living tasks independently before you can do these other things. I give a really funny example when I'm working with kids. When I was growing up, I really did not like cutting meat. My mom would make chicken or steak, and I would refuse to cut my meat. I didn't want to. I thought it was gross. I didn't want to use the knife, whatever it was. I knew how to, but I just didn't want to. And one day, I must have been in middle school, and my mom just said, "How are you ever going to go on a date if you can't cut your meat? Or how are you ever going to go to the prom if you can't cut your meat?" And it's a light bulb that, like, yeah, I can't do those things without learning how to do these other things first. And so backing up and really breaking down what those skills are. Hygiene and daily living skills are big. Communication skills are really important, but there's a spectrum of communication skills. We need to know, is the person coming in needing to learn how to start a conversation, or are they coming in and they need to learn how to keep a conversation going, or how to talk more about interests that other people have that maybe are not their own interests? And then advocacy. This is related to consent. It's bigger than consent in a lot of ways. Self-advocacy becomes so important during adolescence. And it's not just advocacy in relationships and dating. It's advocacy with teachers, being able to speak up for what you want and what you need, what's not working for you. And I'll usually start small in teaching self-advocacy, like helping a kid send that email to a teacher to ask, hey, what assignment did I miss? Or reach out to a friend and say, hey, could you pick up the notes in class for me today? To just start advocating for smaller parts of their lives and then building upon it from there.
And I just want to add real quick that we're not expecting 100% perfection in any of these areas. And like Caitlin said, everybody is going to bumble their way through social situations and struggle in some regard to all of these areas. These are just areas to think about when we're thinking about the overall goals that a teenager might have, or a young adult, and how to support them in getting to that place.
It's a really important point. So we're going to talk about sexual orientation and gender identity. It relates to dating in some ways, but it's also separate. And I just want to set the stage by talking about the difference between gender and sexuality. So, and gender and sexuality exploration is also very normal in adolescence and very common in adolescence. Gender refers to how you identify, and that can be as a male or female or something different. And sexuality refers really to who you are attracted to. And so we live in a largely binary system for gender and sexuality, although that's changing quite a bit. And it's hard but these concepts of gender and sexuality are much more fluid. And so teens are going through the process of figuring out the fluidity of gender and sexuality and what fits for them and their identity. And in the past several years, there's been very interesting work done on gender variance in individuals with ASD, and there seems to be a higher rate of gender variance among teens and young adults with autism. There is also a higher percentage of people on the spectrum who identify as LGBTQ. And so we're not going to get so much into the why that is or why that might happen or occur. We're going to focus more on supporting teens, what to do to support teens through the process of their gender and sexuality exploration. And so there's been a historical belief that cross-gender behaviors need to be changed to more gender normative behaviors. And this can be extended to sexuality as well. And this is largely seen as coercive and harmful for kids, and something that we should not include in any treatment or any behavioral health part of treatment or intervention. What we do want to do is use this more affirming model, the gender affirmative model, which can also be extended to sexuality. And the goal here is to create space to help teens and families explore their gender expression, explore their identity, follow the teen's lead to really understand their interests, and also promote healthy gender messages about there being a binary system that we live in, but that gender is actually not binary, and promoting those healthy messages to really help them and support them in developing their own gender identity. But then there comes a point when a child clearly and consistently asserts a gender identity, and that exploration part of the process may become less affirming over time. And so at that point, it may be time to start talking about a transition or take steps to transition. Now, I will say some of, the exploration piece sometimes does not go along with distress or increases in other challenges, but sometimes it does. If it's causing distress for the person or the family, if families need support in navigating that process, that would absolutely be a time to work with a gender competent therapist or a team who works with gender diverse children, and especially around the tricky topic of transition and what to do and when to do it. That's also a time to be seeking that kind of support. And so a final point here, we've talked about a lot of different things, a lot of strategies, challenges, strengths, but sometimes adolescent years, those transition years can go really smoothly, but other times parents, families, and teens need help in navigating those years. And so we thought it would be helpful to just include some of the things to think about when to seek help. So behavioral changes are a big one. If you see increases in aggression or self-injurious behavior, if you see increases in isolation or withdrawal, or not liking things that they liked previously, not having the motivation to do things that they did previously, any increased concern about mental health, about anxiety or depression or other conditions that may worsen in the teen years, and then any concern for safety, harm to themselves, harm to other people. And then if any of these problems are getting in the way so significantly that it's causing issues or interference in daily life, those are the times that I would be thinking, yeah, this is a time to get a mental health professional or an autism specific professional or a gender or sexuality expert professional. But then there are also those times that parents just need support because adolescence is tumultuous. And so parents may need support in navigating adolescence, and that's a great time to seek a professional as well.
And so we did want to provide a few resources and think about some options that might be helpful for people to dive into these topics a little bit deeper. There are a number of books. There we go. That cover topics related to growing up and sexuality and relationship education, and thinking about how to approach these topics and support individuals where some of those challenges or gaps might be. Some of my favorites for professionals are the Intimate Relationship and Sexual Health, and then Sexuality and Relationship Education. For parents, I really love the Consent for Kids book that's in the lower right-hand corner. It's really great and funny and talks about some of those nuances in a really approachable way. And then we also have some books that are more specific to thinking about gender diversity that could be helpful. And like Caitlin mentioned, this is really a new frontier in thinking about autism research. And only in the past few years have we really kind of delved into thinking about how to support gender diverse individuals on the spectrum. And so there are lots of websites and information out there. There tends to be more limited stuff that I would say that is specific to people with autism, but that's quickly changing. And then there are a number of great websites out there that have different visuals and supports. The NCIL video library in particular has some great videos for people about things like consent or other tricky topics around dating and sexual and reproductive health. And then this is a list of resources that are more specific to gender diversity. The top resource is for the Peers curriculum, and this is through UCLA, and they actually have a really great library of role play videos online that can help support relationships, where they show really tricky situations like how to enter a conversation or how to exit a conversation gracefully, and how to take turns sharing information to help build some of those connections. And then lastly, at the bottom of the slide, there's a little bit of a plug for a new group through Developmental Pediatrics that's for parents in thinking about how to navigate some of these topics for teens and preteens with ASD. And so that is included in your information and can be another avenue of support.
Excellent. This is the point at which there would be thunderous applause. So on behalf of the whole group, I will be doing the thunderous applause. Thanks you guys for doing what a wonderful presentation. I don't know if you've been able to follow the chat, but there's been a lot of really cool questions and comments throughout. So I would encourage you to take a look when we're all done with this during the break. I'm going to do my best to try to get through a handful of these. I'm fairly confident I can't get through all of them, but we'll see what we can do. There was an initial question around differences in opinion between parents. So if one parent, whether they're divorced or together, if one parent sees the adolescent with autism one way and the other parent sees them and might even prefer for them to be more neurotypical, I would extend that question to be, what if someone is supportive of a gender identity and another parent is not? So I'm wondering if you all could speak to how do you handle parents who have different opinions about their teens?
That is a really great question. And Lindsey, I can't see Lindsey anymore. Let me see, hold on. Okay, now I can see Lindsey. So we can do nonverbal cues to each other as much as we can over Zoom. So that is really tricky. I honestly think that it's a really good example of when to probably work with a professional. Because we know that sending the message to a teen that a different gender identity than what they were born as is not as supported at home. If that is the thinking that it wouldn't be supported at home, but the other parent would be supportive of it, that's tricky to navigate together, both in the parent relationship and then also with the parent-child relationship. And I do think that's a time to work with a professional because it's so individualized. I think meeting parents where they're at is important. As a psychologist, I'm often meeting parents where they're at and trying to understand where they're coming from and the beliefs behind, some of their thoughts. And then working together to make sure the child feels supported, but that also the family values are being recognized. That's a very tricky situation. I don't know, Lindsey, if you would add anything else.
No, I think you hit the nail on the head, Caitlin. And I think where I would think about is commonalities in how to best support the child. And so oftentimes both parents, care greatly for their kid and want to help support them. And so having an outside perspective to help think about how you can meet in the middle to best support your child and get the support they need is really important.
Great. All right, I'm going to move us right along. There was a really interesting conversation in the chat around rigidity, and so I just wanted to give voice to that just for a quick minute. And in summarizing all of that, I would encourage you to read it, but my takeaway is that rigidity is in the eye of the beholder. So I think neurotypical people may be looking at autistic people and saying that's a rigid behavior, but I think the message here is that autistic people are looking at neurotypical people and saying you guys are the ones that are rigid. So I think it's a really incredibly important thing for us to keep in mind. So I just wanted to give voice to that. Let's get to some other questions. There was a question around books and resources, and I do think that you guys provided some of that. There was a question around speaking to gender dysphoria, and if you can do it, I know this is a bigger topic, but if there's a way to do a brief description of how it might manifest in youth with ASD, and maybe treat it effectively, like is there a bullet kind of suggestion on how to think about that?
Yeah, well, gender dysphoria, if a child is experiencing gender dysphoria, which is distress related to their gender, then that is a time to work with a professional. It largely manifests in similar ways in people with autism as it does in neurotypical people. You might see more challenging behaviors. You might see more, depressive symptoms, self-injurious behaviors, the distress that goes along with that process. I don't think there's anything that stands out too terribly much in terms of how it would be a different presentation in kids with autism, although the thinking styles that kids with autism have may be different. So the, wanting to use the bathroom for their gender needs to happen. I'm kind of pointing this out as an inflexibility piece, that it needs to happen, right now, and it causes a lot of dysphoria if that's not able to happen in the high school right away, and being more flexible around working through the process to get to that point, to use the right bathroom or to wear the clothes that they want to wear. But it is absolutely, the recommendation really is to, for families to work with a gender specialist who may not have expertise in ASD, but to consult with professionals who know ASD more if gender dysphoria is coming up.
Great, thank you. I've got another question here on kind of balancing the need for teens to have cell phones with the risk of cyberbullying. So I'm wondering if the two of you can speak to that.
Yeah, I'll take that one. That it's really tricky because what we don't want to do is totally limit and shut the door on those opportunities for social connection and really things that help support people in living the lives that they want to live. And so, what we often recommend is thinking about how to scaffold and support skills. So we don't want to totally cut them off, but we also want to teach skills that maybe they need to be taught in order to use the phone safely, or to be able to successfully communicate with peers in a way that's appropriate. And so oftentimes that might involve working with a professional and thinking about what those skills might be, and then having to break it down and practice. You got this comment on your Facebook page, so let's think about how we might respond. How do you think that the person might take that? You can't see their reaction, so we need to think about the words that we use, because there's a lot of other pieces that go into it when we're thinking about technology and social media usage.
And the other thing I think about with cell phones or social media, again, it's a big responsibility. So I like to think about, what do kids need to show to be able to get that responsibility? Like with a cell phone, if they're going to have an expensive cell phone, they have to show that they can take care of it, that they can remember to bring it with them when they go places, and setting up kind of an expectation system that, hey, if you meet these expectations, over this next month, I think then you'll be ready for a cell phone.
Great, thank you. I was just looking at the chat, and there's a little bit of a thread about asexuality, and I'm wondering if you can speak to that. If there's, I'm not sure what the question is necessarily, but maybe it's about kind of how common it may be to have kind of reduced interest or no interest in romantic relationships, dating, those sorts of things, and if there are comments that you all would like to make about that.
This question comes at a good time. I was recently reviewing some of the literature out there on sexuality in individuals with ASD. And it was a common belief for a long time, historically, that individuals with autism were asexual, that the majority of individuals with autism were asexual. And that has been shown over and over and over again to absolutely not be true, and that most individuals on the spectrum are sexual, and have sexual desires and needs and interests and wants separate from their specific sexuality. But I don't know what the percentage is. Lindsey, do you know what the percentage is of asexuality? But I think kind of the underlying message is, from what I've learned and what I've looked up, is that teens, especially with ASD, need more sexual education, that to teach about the aspects of sex, that often teens will show interest in sex and sexuality, and that the asexuality piece, I'm sure there are individuals, just like there are neurotypical individuals who may be asexual. I don't think it's unique to individuals with ASD.
Mm-hmm. Right, and there's some, again, some more discussion in the chat talking about really the diversity of presentation of individuals, maybe aromantic, asexual, gender nonconforming in other ways. I mean, I think it's appreciating the diversity and the breadth of presentation in the autism community, just like in the neurotypical community.
Mm-hmm.
All right, I think I'm looking at my time on my computer and it says 9:45. So I think this is a good time to end the Q&A part. I'm going to do another round of applause for the two of you. Thank you very much.